For the first time since the pandemic struck, we're getting some startling new numbers on just how far-reaching this virus now is. We're talking about tens of thousands of people who never got COVID, but are dying far more quickly than they would have.
News tonight, how people living with Alzheimer's and their families have become collateral damage to this devastating outbreak.
It's hard to imagine a disease that slowly strips the mind of memories and robs loved ones of the joy of growing old together, getting any worse than it already is. But COVID-19 has done just that. For this Stockton couple, Teresa Mandela and her husband Frank, the pandemic has been slowly chipping away at the last remnants of normalcy.
I was going about every other day and spending time walking with him a lot.
For Frank, who lives in a memory care facility, seeing his wife was a routine he needed to avoid sinking deeper into the depths of dementia.
The last 8 months, however, are quite different.
Frank has declined at a more rapid pace. For others, it's been even worse. According to research done by the Alzheimer's Association, since the pandemic began, there have been at least 30,248 more deaths than expected from Alzheimer's disease and dementia. The fingers of COVID's brutal grip have been far-reaching.
People are declining at a steeper rate.
The biggest punch in the gut in this ongoing fight, the ban on face-to-face visits.
We were allowed to have outside visits through a fence.
But seeing pales in comparison to the loving touch and sense of routine dementia patients need.
We know that individuals with dementia really rely on structure and routine and repetition, and those that's been taken from individuals and families right now.
Families like this loving couple needing to hurdle an unexpected obstacle on an already rough road.
The researchers reached that figure of 30,000 plus early Alzheimer's death by taking the average number of dementia-related deaths over the last 5 years, comparing them to the number of dementia deaths in 2020. Anything over that average was considered an above-average number of deaths.